get down to the basics. There's still some people I'm sure that would like to understand more on a basic level as to what this COVID-19 is. So what exactly is COVID and why is it called that?
So thanks, Jamal. So COVID is the name for the disease that we're seeing caused by this coronavirus. The coronavirus is a type of virus that we have seen before, but this particular coronavirus that's causing the pandemic today is a new it's a new virus that has not been seen in humans before. And you may have seen the term novel coronavirus, and that means it's a new virus. And the name COVID comes from the first two letters. CO is from coronavirus, and VI is virus, and D is disease. So it stands for coronavirus disease, and the 19 means the year that it was identified, which was 2019. And I know that some people are still wondering, is this real? Is this a hoax? Over 300,000 Americans have died from COVID. As of today, we're recording this in mid-December. By the time you see it, it will be more than 300,000. And sadly, it's very real, and we're today at the worst part of the pandemic since it started back last year.
Thank you for clarifying that, Dr. Jill. We'll go on to the next question. So we've heard all the different things about how to protect ourselves, but I want to hear from you, straight from the doctor's mouth. How is COVID spread?
In its most basic form is spread from person to person through respiratory droplets. We know that COVID is found in all sorts of different bodily fluids, but the main route of spread is through respiratory droplets. And that's usually through people talking or coughing or sneezing, whatever that might be, and that person to person spread of the virus. Generally speaking, we know that 2 to 3 days of symptom onset is actually when the peak of the virus can actually spread itself, and can continue on through while someone actually does have symptoms of the virus. One of the main reasons that we can get into in a little bit, as you can imagine, that masking is so important is because of this respiratory spread. And we'll talk a little bit more about that, I know in some of the upcoming questions. The other thing that I will say here as well, not only about how is COVID spread, but who are some of the groups that are most at risk? We know that your risk of disease and mortality and death from COVID increases with age. We also know that it increases with comorbid conditions like high blood pressure or hypertension or like diabetes. And we have also seen a disproportionate impact to our Black and Latinx communities throughout the United States.
So Kenji, Dr. Kenji, I just want to highlight one thing that you said, which was that before someone is even sick, they can spread the virus. So that's part of why it's been so difficult to control, because I could be feeling fine, and today is Tuesday, maybe on Thursday I'm going to start feeling sick and realize, oh, I better be careful and not be around people so I don't spread this. But I'm feeling fine today and I could still spread the virus even though I don't have any symptoms yet. And that's called asymptomatic spread, and that's one of the things that's been really driving this pandemic to explode in our communities.
Yeah, and it's an unfortunate thing. I've looked at some, and I've heard you talk about the numbers, and I've seen some data that kind of equated it to some other incidents that have happened, in the United States and around the world, and this is definitely far, surpassed a lot of those. So very unfortunate how this is, rippled. But so we got a few more questions then, as far as how to keep ourselves safe. So masks have been the go-to safety, for keeping those droplets, right, to yourself for the most part. But there's a lot of different masks out there. There's a lot of different ways that people are wearing them. Some beneficial, some may not be as beneficial. Can you guys talk about, how helpful are the masks?
Yeah, the masks are very, very helpful. If I have COVID, the mask protects you if I'm talking to you from my respiratory droplets and aerosol particles, and it also protects me if you have COVID. So it protects all of us, and we all have to do it for it to be the most effective. One thing about the mask, sometimes I see people walking around, or even on TV, some people wearing their mask um, like so, with their nose
Yeah.
sticking out. Some people's nose sticks out more than others, and mine sticks out quite a ways. So if my mask is like this, I'm still breathing particles out through my nose. So the mask has to cover your nose and your mouth,
Okay.
like so. Any cloth face covering is fine. It seems like having 2 or 3 layers makes it more effective, rather than just this is just a handkerchief. That's not as good as some of the commercially available masks that have more than 1 layer. You want to be able to wash it if you're going to be using it repeatedly, and
Right.
you want to have it fit properly so that there's not a big gap either under your chin or on the side. So it's got to fit close to your face to keep all those droplets in. You want to imagine if you sneeze in that mask, it's not going to get all over the person near to you.
Okay, good. Now I know that they have. You said any fabric is suitable, right?
Yeah, most of them are some kind of cotton, kind of breathable fabric or polyester. Yeah, as long as it's got a couple layers, those are fine.
Okay. Thank you, Dr. Jill. Dr. Taylor, can you tell me, are masks dangerous at all?
Yeah, that's another question and comment I've heard as well, which is masks. The theory is that masks in some way or another limit the amount of oxygen that your body's getting, that then weakens your immune system, your body's ability to fight off infection, and actually makes you more susceptible to it. That's most definitely not true. Masks have been used in healthcare for decades, and we know it to be both safe to use long term, and we know that it really works both to protect you from getting COVID, but also to protect others from getting COVID as well. So what I always tell people, I think to kind of double down on what Dr. Jill was talking about, was that the best mask for you is going to be the one that you can wear and wear appropriately. And so most definitely, if you do hear that masks are dangerous, hopefully you might be in a position to let people know that they're not dangerous and that they're really there to protect you and others around you.
Absolutely. I know with a lot of cities reopening, kind of trying to get back to normal, people taking those masks off, trying to get back to normal as well. But it's very important that we continue to wear those as we see the numbers are continuing to rise, and we are at the height of this pandemic now. So it's even more important. Thank you guys on that information. Next question. Being that, we are in the barbershop, I have to come from a barber's point of view. We, already practice, a heightened level of disinfection and safety and sanitation within the barbershop. It's a part of our craft. But, just like anything and anywhere else, people's standards are different. But when it comes to this pandemic, there are things that we absolutely have to do, being that we are in close proximity with clients on a regular basis. These things we must do. And so I wanted to, have you guys chime in on some things that we can do, maybe above and beyond, in which we should already be doing at this point. but above and beyond to make sure that ourselves and our clients are kept safe.
Yeah, it's so important, Jamal. And, you know, barbers have a leg up on this because you already are very keyed into the idea of infection and keeping things sanitized. So that's super helpful as a starting place. And, you know, again, in addition to all the sanitizing and disinfecting that you do routinely, the mask is probably the number one important thing that's going to reduce the spread of this virus. So clients must be masked unless they're getting, you know, a shave, and barbers all have to wear masks. And I would say also, you know, if you can keep a door open, there's been a lot of research showing that having some air ventilation, air movement throughout a shop or throughout a space can really help limit the amount of aerosol virus particles in the air. So if you can keep a door open or a window open, that's helpful. And, you know, sadly, I think too, we have to try to keep our encounters as short as possible. So it's not the time to be socializing as usual in the barbershop. It's kind of, you know, come in, get your cut, get out, and not, you know, maybe not have the social experience that people have come to count on and expect. So I would say those are my top ones. I don't know, Dr. Kenji, you probably have some other thoughts on that.
Most definitely. I think those are definitely the ones to prioritize. And I think the other things that I will highlight in addition to masking and keeping good ventilation in the shops is, you know, at least the barbers I've been talking with here in California have really eliminated the waiting room, which we know is an important part of the barbershop and the culture, but really they've limited their clientele base to appointments, so that, you know, we know physical distancing is important, and so not being in a crowded space is a really important piece of that. I've also talked with barbers about how they're already using face shields and masks as well. But you can imagine those respiratory droplets can get into your eyes, and we know that can also protect you from getting COVID as well. And so, particularly as barbers, you are getting physically close to people and, you know, working near folks' face. And so, you know, having that extra layer of protection is something I definitely recommend for people. And then the last thing I'll say is, you know, that shouldn't be left unsaid, is that if you or your clients have symptoms, definitely make sure to find out where you can get tested, you know, isolate at home as you can and from others, because that is still an important component of it as well, is that self-monitoring piece. Even though we do know that a lot of the virus spreads when we're not having symptoms, certainly while we are having symptoms, it's important to get tested and to encourage your clients to get tested as well.
Absolutely. Yes, thank you. And that is something I truly believe, you know, the majority of barbershops are taking part in all of those precautions. And if they aren't, man, I strongly advise and suggest that you do, or close your doors, one of the two, because we don't want to be a part of the continuation of this thing. So, all right, so we're gonna move on. Next up, vaccines.